Okay, good evening, everyone. I would like to start the Opioid Settlement Fund Advisory Committee meeting today, Tuesday, January 21st, and we can start with an announcement under Mass General Law, Chapter 30A, Section 20F. This meeting is being recorded. So let's start with a Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so we have a few members that are not present. Chief Dunn was not able to be here this evening, and Glenn Nunes is not able to be here, and Laura Charette is also not able to be here, but fortunately we have 5, and that is a simple quorum, a simple majority, so we do have a quorum. So the first thing I want to start with is just to approve the December 10th, 2024 minutes. Does anybody have any changes to those minutes? If not, I
Move approval?
Excuse me?
I want moving approval.
All right, so we have a motion by Craig and second by David. All in favor? Aye?
Aye.
Any opposed? No? So moved and passed. Okay, so the addendum to the charter, we need to have a vote. Val brought it up at the first meeting, and we could not make any decisions about it because it has to be presented to the committee before a meeting. So Val sent it, I forwarded it to people. Does anybody have any questions or whether or not it should move to be approved? It was minor. I will just go ahead and read what the changes were. The OSFAC, which is this committee, aims to ensure that these funds are utilized effectively to address the opioid overdose and addiction is what was added, crisis. Support affected individuals and families, promote related, is the other addition, public health and prevention initiatives, and ultimately prevent overdose deaths and save lives in Westport. So there's some minor changes, some wording, overdose and addiction, and related, and prevention, and prevent overdose deaths and save lives. Those are the things that were added in. Are there any questions about that? No. Do I have a motion to approve?
So moved.
A second?
Second.
Okay. All in favor?
Aye.
Aye. Okay. So just know that we are approving it, but it has to be presented to the select board so that they can bless it.
We meet again on Monday, so if you wanted to have it on the agenda, it should be on the agenda by Thursday.
Okay, thank you. All right, so the next thing I have is member updates. And I know that several people have been working between the meeting on making contacts and doing other work. So I want to give you an opportunity to share with the rest of the committee as well as the people that are viewing the meeting. So who would like to go first with what they have done?
I will.
Okay, Pam.
Okay. So I contacted a girl by the name of Jenny that is in charge of scheduling the Heron Talks, which I highly, highly recommend we try to get that done before the end of this year. So time is of essence.
Could you explain what the Heron Talk is?
Yes. Chris Heron, who, well, I don't know if anybody's familiar with him, the basketball player that played for the Celtics. He was from Fall River, and he struggled with addiction, and he has he goes to schools all over the country, as far as California, to speak, and he does a wonderful job. I believe on YouTube, I think it's called The First Day, people can view one of his talks that he's done. And the charge for him to come is normally $5,500. He speaks for about an hour and 15 minutes, then he has time for question and answers. And then he also introduces the kids to other like peer-run programs for the schools where I believe it's called Project Purple, or,
Okay.
but I'll get more information about that. But he's the one who will he also gives, when he comes to speak, he also brings a lot of references and stuff for the school, a lot of information, and gives a CD, I believe, so that the film can be shown, in the health classes and things like that. But normally it's $5,500, but I guess they're waiving $500 for us, and the cost will be $5,000. They did she gave me a list of the, a date in March and 3 dates in April that he is available. And she also said there are a few dates in May, but he gets booked up pretty quickly. And May can be a tough month, with proms and graduations and everything.
It's also Mental Health Awareness Month, and I run programming then too, so.
Okay.
We just so happen to have someone, the chair of the school committee here. And I'm wondering if you can address whether or not this is something that you think the school would want, because Ms. Charette is not here this evening, so.
Yeah, absolutely. Is the mic? Sure.
And please state your name.
Evan Gendro, Chairman of the School Committee. Not to speak for Laura, of course, but I would imagine that certainly if the committee is recommending it, that the school department would be interested. So any resources that the committee is willing to provide to the school department, we will gladly accept that. So thank you.
All right, thanks.
Thank you.
At the risk of being a process person, I would like to see a written proposal for this from the, it could be from the Heron Project, it could be from the Heron Project in concert with the school department, with a letter of support from the school department, because 5,000 is, for a high-powered speaker with all the curriculum supports and everything else, is good. And if I knew that all the stuff that you referenced is available and would be available to us at the time that we're selecting, as well as follow-up, I could be more comfortable voting for this.
Okay.
Right now, I think I want to see something that we could mull over. And that, again, if timing is a little bit critical and we're not meeting until February, we could block out a date in March or April that would give us time to do this and do it in such a way that the school committee's prepared, we're satisfied, and that we can get the maximum benefit for this program.
May I ask a question? I was paying attention, but are we discussing spending $5,500 to bring a speaker, of the money that we're responsible
Yes.
for, to bring a speaker into the schools here?
It's, 5,000. They waived the 500 for,
I see.
because it's local.
So this is the first I'm hearing about this, so I have to agree with Craig that I'd like to see some information.
Yeah, this is just a reporting time of what people have been doing and sharing the information. We weren't going to vote on any of it.
Okay.
This is just, because what's happening, I know I've done a bit of work, I think that you have, and I know Val has, between the meetings, so that we know what each one has been working on. So we were not going to vote, and I wasn't going to call for a vote. I just wanted everyone to know that that's an option. I also want to let the committee know that there may be other funds that can be used other than this appropriation process through the settlement funds. I've spoken to Matt Armendo, who runs the collaborative, and there's funds in the collaborative to have speakers go to schools, and other communities in the collaborative have already had speakers come to the school, and they've paid for those. So I'm working on that as well.
Great.
Okay. But we do have to get everybody's approval and everybody on board. We just want to let people know what we're doing. We're doing some work. Okay? Val?
Sure. So I am a process person, to Craig's point, and we'll come back to that more. But so I've started gathering different information to sort of help perhaps focus on some of the ways that this problem affects Westport. So gathering State Department of Public Health data on overdose deaths in Westport over the last, 7 years or so, gathering data on EMS, first responder visits for overdoses that are non-fatal for the last, 6 or 7 years. And then gathering some questions that would be helpful to get a little more detail, such as talking to the police and fire and finding out what we can learn from any patterns that they see. Are people having overdoses at home or in public location? What are the common things that for that follow-up post-overdose visit that detectives are doing? What are the primary kinds of support people are asking for? What do they find that is hard to get? What do they need help with? And then also, how might we get information about where Westport people are getting treatment currently? So perhaps talking to STAR in particular in Fall River and some of their programs and asking if they can help, without identifying people, try to give us some information about perhaps numbers of Westport residents in different programs that they have. And even if there are people who are willing, maybe some Westport folks who might do a focus group, or that we could give questions to the counselors at STAR that they could ask people on our behalf, again, about what enabled them to get to treatment, what have been barriers, what could be helpful in town that might facilitate that. So those are some of the things, and I think, I have little bits of it, but I think it'll be more helpful once some more of those pieces are put together to paint a picture, to understand a little bit more about honing in on the gaps and the needs and where people are going now.
Very good. Thanks, Val. I just want to share, I did actually meet with Chief Dunn and Detective Michelle Donovan, who is in the COSUP program, and it's an outreach program for people who are not aware. We found out at our last meeting about this program. I was not aware that when there is an overdose, there is a police detective, Michelle Donovan, who will go out with a addiction specialist, therapist, to follow up and to provide resources. And so I wanted to meet with her and Chief Dunn, and part of my goal was to see if they could talk to some of the people that had overdose that are in recovery in Westport to see if they would want to participate in this committee. My goal is to try to fill that spot. We don't have someone with lived experience in recovery who is sitting on this committee, and that is one of the slots. That is one of the places, right? So that would be our 9th member. So that was why I met. But I also made some other suggestions to them that people don't know about what they do. Perhaps they could do an article on the shorelines, which would bring more focus and attention on this topic and this issue. The other thing that I did was I spoke with Stephanie Barboza. She's a program coordinator, educator, and trainer for First Responders Comprehensive Addiction and Recovery Act. And she represents STAR. So she's a contact with STAR, the Stanley Street Treatment Center. And she also works with MORE, which is the Mass Organization for Addiction and Recovery. And I suggested that she might come and speak to the committee about the work that she does, because Westport is in her catchment area. It's one of her areas. So, I've also been, Val and I have had a discussion about sort of going forward, and she is on the next agenda item, so we can talk about our process. So I don't want to get ahead of what our process is, but I think we need to understand the work that each one of us is doing behind the scenes, so that we're sharing information and perhaps making decisions about who's going to cover what as a committee member. David, you said you were doing some research yourself.
Yeah, well, I read the Massachusetts Attorney General's website that describes strategies for municipal use of abatement funds. And I realized that this is all, what we're doing is really very well mapped out. And I would hope that we don't try and reinvent the wheel, so to speak. There's a very clear blueprint out there for how to allocate the funds. And I think that the Massachusetts Attorney General has identified 7 focus areas. And they enumerate them and subcategorize them in great detail. And I think that we have to interview stakeholders in the community and providers in the community, which you've started to do, and understand how Westport needs map into these 7 focus areas. And then we have to simply find people who would take the money to do work in these areas, and then review the grant proposals. And I don't think that we really have to try and insert ourselves into the community so much as to find out what's going on and try and provide funds to the community and function as a grant review board, basically. We have to determine what our RFA would look like, who we would send an RFA to, what our application would look like, and how to review it. But that way we could do the work that we need to do over a relatively short period of time. And the main thing is to get the money into the hands of people who could do work in the community as fast as possible in a correct way. So, and I've looked at the websites of numerous towns in Massachusetts, which are essentially doing the same thing that we're doing. And I think we can basically imitate what they're doing.
And thus, the copy of the Fall River process that I handed to everyone.
Yeah, well, again, we're so different than Fall River. I think the main thing is we have to quickly find out what's going on here, what's really going on here with respect to specific needs. Because, for instance, I don't know anything about the individual events that we're trying to prevent that have already happened. In other words, the deaths and the responses, the overdose responses. I'd like to actually see that data in detail. I have a lot of questions about that in order to figure out who we should reach out to see if they want to take some of the money and to support what they do.
To that point, we are next door to Fall River. Fall River does not exist in our cohort. if you look at similar communities with similar
Right.
characteristics. So I think, and we don't need to create that cohort from scratch, because although I can't recall, but I've seen several groupings where, there's a group of communities, so if you're looking at eastern Massachusetts and, communities that are under 20,000 people, suburban, rural characteristics, you can create a pretty good peer group that we would want to benchmark and learn from. And maybe that's part of what we do if we're looking at best practices and we're looking at model programs, we ought to see where they are with respect to this cohort of communities that are like Westport.
And I know in the collaborative, the way they have things structured is also different within our collaborative of the small communities. The select board in one community just gave the money to the Board of Health, for the Board of Health to make decisions about, right? And so, but there is a community that is starting the process and has reached out to the Cape, which has a better, or has ahead of the game, ahead of what's going on with, say, Mattapoisett, or going on with Marion or Freetown, which is in our collaborative. So then they're similar. I just took off or printed off the Fall River as just an example of some of the work that's been done. I don't expect us to do that, and it's not the same as, with the things that they have in place. The structure, the infrastructure they have in place in Fall River we don't have any of that here.
No.
So, but it's an example to look at, to see what we might want to use and not use, as opposed to having nothing to start with. And so, but I agree with all of you. I agree that we do have to look at like similar communities, and we've talked about the fact that we need to do focus groups. We need to reach out to people in the community, find out what they need.
I'm most interested in hearing from Detective Donovan, who probably has her finger on the pulse of opioid
Yeah.
abuse in the town. She would know who, what, when, and where. I mean, I have certain theories about the nature of the problem in the town that may relate to the uniqueness of this town, in that we have a huge state reservation, with a lot of summer traffic.
Yeah.
I mean, I don't know how much of our drug problem is due to that.
That's why we have our data person looking into Valerie's work, doing that work,
Yeah.
looking into the data.
Although I don't know that anyone can easily answer that question, but
Well,
it's a good
I
question.
think we could look, I mean, we could find out, we don't have to know names, but we can find out addresses of
Right.
the patient,
Or patterns, right?
victims, or the,
Well, Detective Donovan does have data.
yeah.
And Moore has data. And we are in Ms. Barbosa's catchment, so they have data that we can look at.
I tried to access a database called Matrix, which is basically ambulance runs, and I couldn't do it.
How do you spell matrix?
MAT, it's an acronym, MATRIS.
There is a dashboard
Yeah,
that,
there's a Matrix dashboard, and I was actually in contact with them, but they were not helpful. Because what I'd like to find out, I mean, we're talking about several dozen events, not hundreds of events, right?
it's a small annual number for
Right,
Westport,
right.
yeah.
And that, so we can get our hands around that number and find out really, what is the main problem? And we can identify people who might be able to get involved in preventive work. I mean, there are other things we might want to fund, but that would be something that I'm curious about. And I think, I mean, you've spoken with Detective Donovan already. And
She would be willing to come and speak to the committee.
yeah, and bring the data and, you know, whatever redacted form we're allowed to see, I'd like to see it.
There's some in here.
Yeah.
I didn't give this,
Oh.
I printed it off. Chief Dunn sent this to me, so I can get the PDF and send it to everyone,
Okay.
okay? So that you can look at it, which is kind of segueing into what Val wants to talk about, which is the process to proceed. And again, this was just a forum for us to see what each one of us has been doing, reading about, information you found about, so that we know then again where we need to go from here. So is there anything else that anybody wants to update? If not, we can move on to the next agenda item, which is Ms. Bissette presenting her idea for how to proceed.
Didn't make a formal presentation, but
Yeah, well,
discussion.
discussion.
I think what I would propose is simply that we make a structure based on what we're talking about and sort of sequence the meetings so that we can have sort of homework in between them and, here's a, for example, not that it would be exactly like this, but essentially that we would either invite key stakeholders to come and present to us, kind of do some homework and gather some data to present, perhaps on different themes each time, or in some way sequence it. At the same time, getting public input by focus groups or public events that we would come back and discuss. So, for example, next month we could have Detective Donovan. I could share what I have. We could pick 3 things that we're gonna, or maybe 2 that we're gonna drill down into, and then discuss. And then the next month, maybe it will be someone from STAR coming, maybe the Warrior Moms, at another, so we would sort of sequence out a plan like that, having to be flexible, of course, as new things arise, and new information. And then, based on that, start to shape that into, once we're done, but also as we go, some of our sense of priorities from what we're learning. Like, oh, this seems to add up to, there's a real need for transportation to Fall River for treatment, or this seems to add up to, here's some patterns, or, people aren't aware of where to get naloxone and test strips, or, so that from that data along the way, we're gathering information and prioritizing, and then we can investigate that further, and then turn that into your request for proposals or something, and set a timeline for ourselves. But if we have a theme and some homework, like, I think it's a great idea to, Craig, to have somebody or a few people do some benchmarking, as one of them. Let's see what other comparable size and rural character communities have come up with for their plans. Now, it won't be exactly the same, but it's a good springboard. So that we could agree on at least the next few meetings and roughly think about a sequence, and then we sort of know where we're going and what information that we agree we want to gather together and discuss ahead of time, and who we want to invite for future meetings.
Let me ask a question. What's your timeline?
Well, I mean, I think it's our collective timeline, but honestly, my instinct is, well, there's 2 things, right? The state will need a report at the end of the state fiscal year, at the end of June 30th. I would say, I could imagine if DPH sees that we're in a serious process with a clear timeline, that's likely to satisfy them, but that's certainly worth exploring. But I would say by having something ready by, like, an RFP by the summer, something like that.
I think we could do it much, much faster.
I'm not sure we could do it well and much faster. That would be my concern. But why don't we map out, like, what is it that we want to hear from people? And then we also want to, because we're meeting once a month, but let's sequence it out. Like I said, I just think it's better to be elastic than rush. If we have everything we need and we're ready earlier,
Well,
great.
may I speak?
Sure.
I think that, you know, there's, what, 125K sitting in the bank right now, right?
There's 300.
300. So there's a lot of money sitting unused. So it's much more than I thought.
It's been there for a while.
Okay.
So
I-
we haven't
I think
2023.
we should get the money into the hands of people who can use it a lot faster. Because the timeline you're proposing is gonna, I mean, if we have an RFP by the summer, then people wouldn't be funded until a year from now.
Till the fall or late summer,
Up in the
potentially.
fall.
You can do an RFP and turn around funding within 30 to
Couple
60
months.
days.
Yeah.
Yeah.
This is contract negotiations and, you know, we also have to sort of look at the, if we got accountability to the state for reporting how we're doing the money, we got to look at when those reports are due and for what period, and to see how we're stacking up against it.
I think I read somewhere it was October 1st. that they
For
had-
this.
Is it for
fiscal year.
this? Yeah.
My understanding
I
is
read that.
that this town created a stabilization fund, is that correct?
That has nothing to do with this.
But I
Yeah.
thought that allows them to, I thought that allows the select board to spend the money when they decide to spend the money.
It's
I think that's
available to
true.
spend now.
It's already encumbered, is it, I mean,
There's a
I-
fund and there's a separate fund, and it was voted on in the last town meeting, that we have to create and put that money
Yeah.
in a separate fund.
So,
in other words, we're sort of sitting outside of we're in the town operating budget, but we're sitting outside of the parameters of the town operating budget.
so my feeling is that we should proceed much more rapidly and devise a way of getting our survey done fast, and then identifying people to make proposals. Because that will be the bottleneck. The bottleneck will be, for instance, let's say someone in the high school wants to have a program and they want some funding to support that program, just as an example. And they would apply to us for funding. But for them to write the proposal, to have a budget that we can review, because we have to create the template, we have to create the budget template, we have to create the application template, and then we have to have a review process. That's going to be the bottleneck. And I think that we should swiftly identify people we should identify areas that we want to fund in the town, and then we should swiftly identify people who could apply for money to address the areas that we think this town would benefit from. But I think it's going to be a long time to get those proposals written and submitted and reviewed. And so if we spend a lot of time just getting information, I mean, for instance, I don't think we need to just do business at the meetings. I mean, I have enough time to do interviews and things like that, other than at the meetings. And I think we should strive to have money in people's hands by the fall.
Yeah.
Yeah,
That was-
I
that
think
was
that's doable.
That certainly is my idea. So when you're saying swiftly, we have to remember, we've had one meeting, and we've had money for a while, and there was no plan or anything.
Right.
So this is the beginning. I would love to know exactly what we're going to do and have the requests for money into us, as Val said, in the summertime, and be able to then distribute funds in the fall. But there are some other steps, right? And I think that certainly getting data helps us decide like where we want to focus what the need is. If the need is transportation to Fall River or New Bedford to get to treatment programs and people don't have that, are we going to provide money and have there's another piece of paper there that addresses what Fall River did initially, where they allotted funds for individuals and families who could request money to help with transportation, to help with recovery programs, right? That was part of it. So if that's something that we wanted to establish, we could ask the select board to establish that fund, right?
Right away, is that what you're saying?
Well, I mean, you're talking about swiftly. We could ask them, if the committee is in agreement with that process, then we could do that. But we would also have to figure out, well, how are we going to decide if somebody in the community wants money? How do we decide who gets money? And how much money are we going to give? So I'd love it to be swift, but I think there's a lot of details to be worked out.
I cringe at individual aid. I got to be honest with you. In my experience, we've done it. And in the times that I've felt that we did it successfully, we offloaded the review and the evaluation and the selection of the individuals to receive the aid to be done by a third party. And that third party would create the financial control sufficient to make sure that the funds were being used. And what it usually occurs is not giving money or even giving a grant, but creating a voucher system where that voucher is either you negotiate with a cab company or a transportation company, you negotiate with a supermarket or a food service provider, so that we're not writing checks to people.
Right.
We're issuing checks to vendors that are then evaluating and creating the ability to.
You did that with the United Way, not with the town. Did you do that with the town?
No.
Yeah, when you were part of the United?
Well, no,
Way?
other, I mean, I did that with another agency before United Way,
Okay.
but with the town, I do have some experience with the town, because the Affordable Housing Trust, we have benefited people who have been able to qualify for moderate to income housing, that we have provided assistance to 2 families this past year for, to be able to construct and live in a duplex in town. But and we also worked with a partner. So in that case, it was Buzzards Bay Habitat for Humanity, that's what they do. We had the money, and they had money too, but that was our partner in terms of selecting the families and working with them, and then also recruiting the vendors that were going to do the donate and provide the construction expertise. So I always think that if we're going to get into, it's not the word procurement, but grants and procurement,
Yeah.
that we're using the third-party system.
Okay.
And I think you all understand that, but I'm saying that because we are being televised, and this is a public meeting, and I
Right,
wanted to
right.
make sure that somebody gets this and then sort of distorts what we were in
Right.
fact talking about.
And it strikes me that we could have someone from Fall River's Advocacy Fund come in and talk about how they're managing it, or someone could go do that research and bring it back.
Yes.
And I think it sounds like we're not that far apart, but I wonder about either trying to do now or some combination of now and with a sort of structured homework, if we built out, what are the questions and input that we would like? What do we want to know, basically? And who do we want to invite? And then sort of sequence that out and even back up from, like, if we wanted to go aim for, a request for proposals by whatever, We could start with June, we could aim for May, but whatever. Then what would it take to get there?
Well, I would propose that we work from the template provided by the Attorney General. They enumerate 7 focus areas, and we could split them up.
Is that what's in the abatement agreement?
Yes.
Yeah.
You want me to just list them?
Yeah,
Go ahead.
just remind us here.
Opiate use disorder treatment, supporting people in treatment and recovery, like transportation, connections to care, harm reduction, you know, test kits and Narcan, needs of the criminal justice involved personnel, and support for pregnant and parenting women, and preventing misuse of opioids and implementing prevention education.
Right.
So those 7 areas are, that's what the state mandates,
Right.
basically.
And-
And I think we can divide them up, and we can report on, you know, find out what the needs of Westport, how the needs of Westport map onto these 7 areas, and identify people who work in these 7 areas, and tell them to apply for money.
Although, you know, I agree, but I can imagine even if we did two subject areas a meeting, you know, that's 3 meetings to attend to 2 apiece, to sort of learn enough to say, because I absolutely agree, those are the categories, and they're even spelled out in some more detail.
Yeah.
But the magic is, where do those dovetail with the need here, which, you know, you've said as well, and
And that's where focus,
focus.
where we interview, we
Getting
get
input.
feedback from people in the community, which is part of the abatement agreement, community input. We are community, but I want to further community input. So whether we ask warrior moms to come in, Pam's group, whether we poll or interview or speak with physicians who are in the community, because I asked David, who is also a doctor, to see about possibly reaching out to them.
Well, yeah, I mean,
And
they write the prescriptions, so I don't know how much they
Both ends.
well,
to
but
tell me.
well,
But for instance, I don't know, are there any organizations that actually provide treatment
Star.
other than STAR, in this town?
In this town? No.
No, and.
there may
none of
be
the
some
primary-
therapists who are working with people who are struggling with opioid
I would think there are.
disorder.
I
Yeah,
would think
so,
there are.
so certainly reaching out to people who are treaters
And
in
you have
town.
lists of those, because you're on the Board of Health, you have lists of shrinks and.
We do not.
No?
As far as I'm aware, we don't have a completed list of everyone in
Oh,
town.
I have ways of doing that,
Yeah.
but I don't, I mean, other than, I don't know of any treatment centers within the town.
No, there are not.
Probably
Individual
therapists that do that kind of work.
Right.
We, as a matter of, just to make sure we don't miss anything, we should contact South Coast Health.
Yeah,
Oh, yeah,
Because-
well, I used to work for them.
Yeah, because in terms of what do they have maybe as affiliated providers? There are facilities, there is at least one facility in Westport,
Oh, yeah,
and,
and there's one in Dartmouth.
Yeah.
Because there's a large behavioral health building in Dartmouth. And South Coast Health actually put out a community needs assessment
okay.
that's online, that talks about this kind of stuff, but not specifically for Westport. So I know the person in South Coast who does this work. She's
Okay.
the main primary care doctor, and I'm gonna ask her what she knows about Westport.
Right.
And
Okay.
I'm sure she knows a lot.
all right, so it really does segue to the next part of the agenda, which was to talk about focus group, community input planning. One of the things that Val had mentioned, and you have mentioned, is a survey. And I know that that was one of the things that Fall River did. So it would be coming up with a list of questions, and we could put it on the Board of Health website, the town website, but then who else are we going to distribute the survey to? The other piece to that, so that would mean somebody writing up the questions.
Yeah.
Would that be something you would be interested in, David and Val, or anyone on the committee interested in developing a survey?
Yeah.
You would?
I'm interested
Okay.
in that. I
Okay.
think that's actually a very important thing. How, and the PIRE, P-I-R-E report in Fall River goes into gory detail about how they carried out their interviews.
Right.
It's incredibly detailed.
Yep.
And however, we need to customize the interview, the survey form for our town.
Why don't you and I work on that together?
Yeah.
All right? And the other, so we'll work on that between this
Yeah,
meeting and next. And the other piece to work on is setting up some focus groups. And I would be happy to take the lead on that because of my background in mental health care. But I would need help to run the groups. So I'm asking if anyone else on the committee would be interested in doing focus groups with me, where we're interviewing, where we're asking questions, we're asking for input and feedback from people in the community.
Yeah, I
mean, I think
as
would
many
like
of
to
us who
be on.
can probably should be.
All right, well,
I could
good.
definitely help with that.
So the next step then is going to be, I would like to at least have a focus group before the next meeting. And it may be targeting, say, your group of warrior moms who are moms who have struggled or who have had children,
I've lost a child.
lost a child, to see where that need is. That may be a good launching point, and you and I could maybe do that one together.
Yes.
And there's going to be one that's going to be general in the community where we communicate to the community, this focus group is going to happen. We welcome anyone from the community who has any concerns, has any feedback, has any valuable input or suggestions for how this money can be best utilized to meet the needs of the Westport residents. So that is, my thinking, it might occur in the library, in one of the library rooms. It wouldn't be, the focus groups are not a mandated open meeting law where you have to have it filmed or recorded or anything like that. It's just getting feedback from people in the community.
Yep.
So to establish another one, perhaps at the library, and try to do one during the day and one during the evening. It could be in the same day, but the library's pretty busy. I just reserved a caregiver support group meeting that I've started. So
Would there be, would we be able to use the school?
we might be able to use the school. We'll have to check with Ms. Charette. I don't see a problem with that, but we would just have to see, what's that?
Or the annex.
Or we could use the annex
The
too.
meeting room, the annex.
I'd prefer to use, like, being someplace more public than, an official building. I'd like it to be a more relaxing atmosphere for people, so they feel comfortable sharing, and other than having it in my living room, I'm not going to do that, but I would like to do that, so I would like at least one person. Pam, why don't you and I look at a time where we can meet with the women in your group, the moms in your group?
There may be a couple that are willing to come, but I know other people.
Okay, that would,
Yeah, other people.
that would be great. And then a
I prefer
general,
them to be from Westport, though. I mean, I know people from other towns
I-
that have experienced drug addiction in their family.
right, it would be best if it's somebody from Westport, what their experience is, but if there are others that want to give feedback, there may be people in the community that are very interested and know of someone in Westport or know of circumstances that may want to contribute ideas. And remember, our goal is that we get the ideas, we formulate, and then we present to the select board for the decision about where the money is going to go. We help them make the decision, but it's up to them to allocate the funds.
Could I just add one important thing?
Yes.
Because I've had to deal with STAR, and I know quite a few people that work there. They have everything. They have parent support groups. They have, they work with the state, so they know, they have all this information about transportation, and they offer it, and anyone from Westport could go there. It's a 10-minute ride. So I strongly feel, especially if we want to use money that's been sitting all this time, and it's a very easy process, is to start with prevention, speakers, especially now while the school is still in. I mean, that's how we can talk to the kids and the parents and talk to the PTO. And to me, you can treat addiction like cancer, right? So early intervention, trying to prevent these kids from experimenting, because that's what's killing them. And they're starting very young.
Do you know the school nurse in the high school?
There's more than one.
Well, there must be like a head nurse.
Yes.
So wouldn't that person know a lot about what's going on and?
Well, I think Ms. Charette has her finger on it. I think she knows what's going on. I've also met with the adjustment counselors at the school.
Oh.
I have a relationship with, there's at least 3 adjustment counselors that I've done presentation with. So that's very easy for me to contact them and hear from them. But part of the plan is to do a focus group where we're including people, the adjustment counselors, the teachers, the parents, anyone who's interested in sharing their experience and then making recommendations. So yes, I've worked really hard to try to establish a relationship with people in the school system.
And do we have any idea of how many clients at Star? That's a big operation.
That's one of the questions.
How
that-
many
yeah.
From
clients at
Westport?
Star are Westportians?
Not yet.
I could probably
That's
get
a
that
question.
information.
Because that would
Would you
be-
try to get that?
Yes.
That would be
All right,
great.
that would be great.
Yeah.
Wonderful.
I think the follow-up question is, can we get more information about this?
And some differentiation for what types of services?
Yeah.
I mean,
What-
Yeah.
what types of services are being delivered to Westport residents?
Oh, I can get that information, yep.
Because what'll happen is, I know Star has professional grant writers. So if we put out an RFA, they will instantly apply for the maximal amount of money that they can possibly get. And it would be important to know what kind of services they're already providing, because we'd have to sort of craft our RFA in such a way that Star doesn't suck up all the money.
Well, I mean,
Unless it's merited.
well, right, and the
But
thing is that
they're professional.
when we do our RFPs, we want, in getting the data to see what do we really need? Like, what do people in the community really need? I think that's where talking to people is going to really help us kind of make decisions about what kind of RFPs we really want to, what do we want to see in the RFPs. So, I have said many times that I am very concerned about the lifespan of people and how this has impacted the lifespan. I'm very interested in the kids and what's happening with our kids and making sure that there's funding for the schools to do programming. I've already talked to the adjustment counselors about coming up with an idea and to think about formulating a proposal and what the cost would be, because I've been approached about running groups in the school for the students. So if they have a therapist that they can have money for to pay for students who might be struggling in the school, they don't have the funds, I want the funds, I would advocate for the funds to help the kids, so, and to do that. But,
Does the Board of Education have its own grant writer?
I have no idea. Do you know, Mr. Gendron?
We do not have our own grant writer. Currently, when we do have grants, it's from folks who are, grant writing isn't their only job, so they have,
Yeah.
other responsibilities. But we don't have a dedicated grant writer.
Does the town have
No.
a grant?
No, that's been an issue, right, Craig?
has been an issue.
Yes, yeah,
Okay, okay.
yeah.
Thank you, that's
So,
useful.
yeah, so I mean, these are building blocks, right? We're building. And I agree with process. We have to watch our process, but I don't want to get so bogged down in process that we don't get anything done.
No, I agree. I'm just saying that it's got to be, if you decide you want to go in a certain direction,
Right.
we have to decide at the same time how we're going to get there.
Right. And so if we were promoting one aspect of the abatement agreement, education really is one of the easiest ones to do, and there are already ideas about how to educate people in the community, and then looking at building programming. I think programming may be a little bit more difficult, but education right away, we can do some things with that. And of course, Olive has lots of ideas. She's already used some collaborative money for that, for those things, but I think that there are other programs and ideas that we can pull from. So So as far as, I put the grant application development on the agenda. I wasn't expecting us to develop the grant application, but I wanted to bring that up so that we can begin to look at how we want the RFPs to be structured. And what do we think is important to put in any RFP that we have? I have no experience writing these, so I look to the people who do have experience writing these.
I mean, you decide how much money you have, what do you want to spend it on, and what is the time frame for getting rid of it, and then, and spending it. Then the second thing is, we need to run it by the management of the town to make sure that we're doing this within the procurement systems that we have, that we're bound by. Because, when we're not, I mean, we found this out with the Affordable Housing Trust, when we did an RFP for land, because we had a budget for that, we still needed to rely upon the town administrator's expertise to make sure that we were constructing the RFP for that purpose properly. We knew what we wanted, we knew when we wanted it by, and we already had the money to do it, but we still needed the process to underscore what, so we needed to know if we decided what the RFP was going to be, and then we had to advertise it, and then we had to allocate a certain appropriate amount of time for responses, and then what is the time that we're going to make the decision, followed by when does our meeting schedule overlap with all those three things. We're going to be in the same point. Having a subcommittee or having a work group that could do some of the work, so that when a committee gets the information to move it to the next stage, we're being well prepared, we're being well briefed, and we have materials in front of us when we do that.
What's the next step do you think that we need to take, since you have experience doing this?
I think the next step is to do two things in parallel with each other. One is to start to gather data and to do focus groups. Start to put together a procurement process that says that we're going to allow ourselves so much time to create what the priorities are for an RFP. What is the time frame for issuing the RFP, replying to it, and then evaluating the proposals, overlaid with our meeting schedule. So you really got sort of three things: gathering data, doing due diligence to prepare it, working on the process for the RFP, and then dealing with the decision-making timeframe.
Okay.
Do you think that after we've gathered information, we've sort of satisfied our curiosity about things, that we could take the money and put different amounts into the 7 categories, so that when people apply for funding, there would be a maximal budget?
Although, I think hypothetically, with multi-service providers like Star in the mix, you're going to be getting proposals that'll hit on 2, 3, 4 points of the 7.
Problem.
Yeah.
For
So it's creating 7 buckets, I think is going to be, because of the size of the town and the scope of what we're doing,
And the amount of money we have.
the amount of money we have, and then starting with 7 buckets, I think would drive us crazy. But
And I really don't think we're going to hit all of those 7 items.
Well, that would be, I think, up to our discretion. For instance, I think we could say, for instance, just to give you an example, I'm not saying we will decide to do this, but we might decide not to directly support opiate use disorder treatment.
yeah,
Right.
That would be something we don't think the money should go to that. And that would make 6 categories.
well, it would seem to make sense if you're looking at, I mean, although things are changing as daily, but in terms of what are available third-party sources, Medicare, Medicaid, and other sources, as well as the discretionary grants that some of these agencies may have to provide treatment, irrespective of third-party status of the recipients. But treatment may not be something that, you're right, that we would want to support for all those.
And the category support for pregnant and parenting women, there may be no provider that we could identify who would be likely to provide that category of support.
We may be able to provide, or there may be someone willing to provide some other services that might support the mother. So, you know, I think that that's why we have to reach out and
Yeah.
get people's
Right.
input into what they really need. Maybe the mother said it would really help me if I had, you know, an hour to go, or I need somebody to help me with my child while I go to treatment. You know, something to that effect, but I think that we need to hear from them.
Certainly, but again, my point is that we may be able to narrow down these 7 focus areas so that we can put substantial amounts of funds into those areas, those buckets. And that, you know, because, I mean, when you apply for grants, there's always a max, you know, there are always budgetary recommendations.
Right.
And I think I think that's a decision that the committee should make.
Yep.
But we don't have to necessarily rule out, we can decide with what's in front of us too, just like what's the spread of services that we
When we
want.
send out the RFP, there has to be a budget recommend, you know, they have to submit a budget.
Right, right. But we don't have to say, we don't have to ask people to apply in a particular category.
Well,
So we could, as long as it's within, you know, because we will set out our priorities. You need to address at least one of these things. And then we see what we get and what looks best to meet the needs that we've identified. So I think we have ways to make those decisions without limiting, you know, who applies to.
Yeah. Okay. All right. So you know, I'm glad that we're having this discussion. You have something to say, Mr. Jen?
I had a question,
Yeah.
Madam Chair, if I may. I'm not sure if the committee perhaps hasn't gotten this right, I know it's still early in the process. But because the disbursement is done over, is it over a decade?
It goes to 2038.
Okay.
But part of, discussed trying to create an avenue where it lasts longer than to 2038, that there's some sustainability by not spending everything all at once, kind of thing, and looking at programming that's effective, because part of our job is going to be evaluating, you know, the programs that, or the things that we are supporting. There's going to be, we have to report that to the state, right? What have you done? How many people were impacted and all of that? So I mean, I like the idea of some kind of level of sustainability.
And with the applications that were discussed, are you envisioning that on an annual basis, similar to how CIPC functions, where departments and programs will come to you on a yearly basis to say, this is what we're recommending, and then the committee will?
We haven't
gotten there.
discussed
I
it.
haven't got that far.
We haven't gotten that, I mean, this is the second meeting,
No,
but that
absolutely.
certainly
It's a good question,
is.
but yeah.
Yeah, it's a great question,
What would be-
and,
What are the funding cycles?
Right, right.
yeah.
I mean, I certainly know from a grant-making perspective, it's ideal not to have to apply every year. So there may be certain things that make sense for, and other things that it doesn't, so, but yeah, we haven't gotten there.
Yeah, we'll get there, though. Thank you for bringing that up.
Has the state determined what the annual payout to the town is going to be?
It's 35,000. So for, say, for like Fall River, a big city, gets more than that, but our size of our community and the data that they looked at, they said, this is, if we were getting less than that, we would, I don't think we have to do the reporting that we're required.
Under 35.
Yeah, we don't have to do, but we get 35,000, so, and that's going to be till 2038. And that's why we've received funds, but nothing, there's been no plan yet to how to use it. That's why we're here, right? That's why we're here. So, but it's 35,000 a year. And we do have a certain chunk of money right now, but I don't foresee us just spending that. I foresee us using some of it, and we have to talk about how much do we want to use initially.
I think, though, we got to be careful about making that assumption about sustainability, because if this is a settlement, and the settlement is paid, A, is the money already in the state coffers, and what they're doing is setting up a budgetary process for cities and towns to spend the money? B, at the end of that period of time, 2038, should
You
we have
have to-
spent
we
the
have
money?
spent it.
Should we have needed to have spent?
Or
So
will
tho-
they decide we
Right,
didn't
yeah.
need it?
Okay.
Or we
In other
don't
words,
need
so.
it?
Good question.
So saying that we want to make it sustainable may be through other sources or other
Right.
resources, but I think we have to look at the settlement money as a finite pot of money that unless, I mean, I'm viewing it that way now because I have no other reason to understand differently.
Okay. So a good question would be to ask,
Whoever the state
once the money has stopped, how long after the last payment does the money have to be spent?
I'd rather find out what is the status now? Is this a fixed amount of money? Has this been a settlement that was?
So, yeah, it is a settlement.
And then the payout of that fixed amount of money is, in our case, based upon our share of the settlement, is $35,000 a year through 38.
Okay.
Then maybe the issue is, does that mean we have to have all the money spent by 38? And if the answer is
Right.
yes, because it's a settlement agreement, and you agreed to, the Commonwealth agreed to do A, B, and C by 2038, then I think it's a moot point.
Okay. So that's something that we have to find out.
I think earlier rather than later.
Okay.
I mean, but it will not affect what we're trying to do in the next near term, but it does affect the way we're planning, because if you're looking for sustainability using a settlement, and that's not the purpose of the settlement, then we're going down
Okay.
a detour that we don't need to be going down.
Craig, has the select board decided how rapidly they want this money spent?
No.
So they've not said anything about the
I mean,
disposition of the money? That you know of?
I say this as the newest member of the select board, so, well, newest member this time, but, because I did this a decade ago, so, but the point is, there may be some agreements that we signed in order to accept the settlement money, and we just need to, as a committee, know what that is.
Okay.
I know.
Do we know if some of the money's already been spent?
Yeah, we allocated some money at town meeting last year
To,
to the police
what?
department.
Oh,
To do,
do you know
To
how
do
much
what?
that was?
No, I don't. It was voted, I was there at town meeting.
from the opioid settlement fund?
Yes.
Okay.
Yeah, I think
Wow,
that's
I
why.
didn't know that.
all
I
of us
didn't, I
upset.
didn't know that either, so I will find out
In
about that.
2023.
Yeah, it wasn't
Tried
a,
to look it up. 'cause I thought we
2024.
could
Really?
find it on the
Yeah.
website, but I didn't see it.
Okay.
Well, that's got to be.
Now, I also, when I was trying to research on the computer, I didn't get to look real deep into it, and I'd love to call somebody, but they weren't open by the time I found this. But it's called CARE Massachusetts, and it's an opioid abatement partnership program that provides guidance and support and technical assistance to people that receive the funds. So whether it's a free service and they've been funded,
good question.
I don't know.
I saw that website, and they allude to something called the John Snow Research and Training Institute.
I know them. They're a well-known and respected public health organization. But they have a lot of contracts with the state, so,
And we can get free training from them, according to the
That's what I
Massachusetts
think.
Oh, that's
website,
interesting.
that they suggested that municipalities
About CARE.
who are in the process of determining how to spend the money sign up for this. And there's a sign-up sheet, form, where, I mean, I think it would be appropriate if the chair does this.
Okay.
And, I mean, whoever, I don't know what the website did not say what programs are available, what the training constitutes.
And it's called Care Mass?
CARE Massachusetts, yeah.
Okay.
Where's the John Snow?
their headquarters in Boston, but they have sites, around the
national
state.
thing?
I don't know if John Snow is national. I think John Snow is national, and Justice Resource Institute is not, but yeah.
I just learned about it this afternoon, but I'm going to read more about it. But you could sign up for it, and whatever they tell you may be useful.
Okay. thank you for sharing that resource. All right, so does everybody have a to-do list or anything that I talked to you about?
I have two
contacting
things to do.
Yeah, and Val has things to do, and Pam and I are going to work on setting up focus groups. We're going to start with the moms, the warrior moms.
And
Is there
I'll
anything else-
also,
Is there anything that you would like to do, Craig?
I'll help.
I have a
You are helping.
suggestion that
Yes.
maybe Craig can help me with. My brain is hungry for sequencing.
Yep.
So maybe to propose a meeting / research / timeline for procurement
Yep.
schedule that overlaps with our meeting cycle, if you could help me with
I
that.
could do that and also, take advantage of the town administrator's expertise in area to see what we need to, what we're bound by so that we can create that timeframe.
Yeah, could you find out about the allotment of funds and when it has to be used? If the last amount given or to us is in 2038, is there a time frame that it has to be spent by? So do we have a year after that date, 2 years after that date?
I think we ought to know is what did we, what.
Do we
what is-
sign?
What is our obligations?
Yeah.
Under this?
Yeah.
We must have signed something, or it must have been tried
Right.
for us.
So if you could take care and find out about that.
Yeah.
And then I will plan for, well, I'll be in contact so that I can formulate an agenda for the next meeting.
We may find out that some of this also circles back through the Board of Health, too.
What do you mean?
That at some point in time, sometimes these things go directly to the Board of Health. Maybe not the money, but I'll find out, but I'm saying that this, I wouldn't be surprised if somewhere along the line, this distribution chain somehow involved the Board of Health.
Well, the decision's made by the select board, whether or not they want the Board of Health to make any decisions or direct any money.
Yeah, I'm just double checking.
When I spoke to Mr. Armendo, he agreed that the Board of Health would help with the, and along with the committee, would help with the reporting. Because our town administrator had asked the Board of Health to do it before, but we didn't do anything with the money. We had nothing to do with it.
Okay.
So, as I said before, some towns, the select board said, we are allocating this money to the Board of Health to make decisions about it, but we did not do that here. So, but the Board of Health that's why I'm here, on board to work with the committee, with the select board on any reporting or things that need to be officially done. Okay?
When you meet with, well, I'd like to speak with Detective Donovan in some way. I have a lot of questions that
Could-
I think she would have answers to.
Could she come to our next meeting?
And
Yeah.
the
I could ask
question
her.
is, should we talk to her as a group, or, I mean, would anyone mind if I called her and asked, said, can I talk to you?
Well,
Or, I mean, we don't want to bother her, and, we don't want to duplicate our efforts. So the question is, should, Val said, would she like to come and talk to the
she said
committee?
she would when I met with her.
Oh,
So,
Is that the
and
best
this is the Bristol County Outreach Program. This is through other communities. This is in Acushnet, Attleboro, Dayton, Easton, Freetown, Fairhaven, Mansfield, Norton, Rehoboth, Seekonk, Somerset, Swansea, and last, Westport. So this is a program, this is not just the police department, this is a program that's in Bristol County. There's funding for it, they have support, yes, and what I'll do is I'll send, you can have that, and I have the PDF.
send me the PDF.
I can send that to everybody, so you can take a look at it. But I'd be happy to ask Detective Donovan to come in and speak to the committee. She was very open to it.
Is this program funded by the state?
I'm not clear on where the funding is coming from. It may be in there.
I think that Chief Dunn said last time it might be a federal funding stream for that.
Yeah. So,
Oh, yeah, I see, it's data, there's actual data, but it's not, is it broken down by town? Must be.
We could ask her for that.
and I will do that. I'll send her an email and ask her to appear at the next
So
meeting.
we're gonna have access to her, and I
Yeah.
will, so it wouldn't be appropriate for me to reach out.
Okay. And if she's not able to come to that meeting, I will maybe try to arrange something so that she can speak with,
'Cause I'd like to
speak with you.
I think she's the best source.
Okay. Well,
Could I just say, so I'm just concerned that if we don't make a decision soon and talk to the schools about Chris Herron coming to speak, if anybody wanted to hear him, and you can YouTube that, I think it's called The First Day. He's an excellent speaker. He really reaches out to the kids, and then he offers other help and programs, and he works with, also works with the school counselors afterward. But I feel like if we can put that on the agenda to try to do whatever we have to do to get that moving, or else we're going to miss another year.
okay,
What do
so,
you think the drop-dead date would be?
Well, I have the dates of when she said when he was available in April, and she said to try to get back to her as soon as we could to book it.
so
So-
what I would suggest is that you reach out to Laura Charette. You can send her an email, say that we discussed it. We want to know if she, if there's time in those dates available at the school, because they get very busy and they
know.
have programs.
That's my concern.
When, but if it's during the day, if the students are there. So she would be the one to coordinate that. As far as the funds go, I will double check with Matt Armendo about asking for funds for a presenter at the high school, so that it won't even come out of the opioid settlement fund. It'll come out of the collaborative money, because other communities have had speakers come, much more money, out of the collaborative funds. We have not done that.
If the town gave money to the police department without any review process.
I don't think we want to replicate that, though.
No.
I'm just saying.
No.
No.
That you could say there's precedent.
I think that there's funds for it, because I spoke to Mr. Armendo. I know about the collaborative and what funding is there. Education is a big part of the collaborative, and they have used that money in other schools. The Tri-City, they had, I don't remember, it was somebody who talked about cyberbullying, and she did a group for the students and a group for the parents.
Nice.
And that was much more expensive than Mr. Herring, because it was two. So you contact Laura Charette, get a feel for her about if any of those dates are available. I will talk to Mr. Armendo. I have a Board of Health meeting tomorrow, so I will be able to talk to him and find out about securing those funds. And he knew it was $5,500, because he's used Mr. Herron for other things at other schools, but not in Westport. So that's why I know there's funding available outside of this, but it's a great step for us to be, what's the word I want to use? Supporting and spearheading getting this speaker, okay? I'm just aware of the time, and I know everybody's time is valuable. We've had good discussion. We have two people here who are visiting to hear this, and I don't know if they have anything that they would like to add or respond to in anything that we've talked about.
I have a few questions.
Could you, go up to the microphone, please. Yes, if you have.
And my name is Shelley Honeycutt. I'm a resident here in Westport, several decades. So I have a few questions, a few concerns, a few observations. I'd like to say, I know this is new, so the chaos, right? I appreciate it. I'm excited to see Mr. Dutra on the committee because of his historical knowledge and what he brings to maybe get your committee going more quickly, right? And I appreciate what this gentleman said about reinventing the wheel, not doing it. Time is of the essence. We have such a great opportunity, and it could save lives, right? So reinventing the wheel, probably not the best idea. Let's look to the communities that are doing it well, that are similar to ours. And I became aware of this new opportunity maybe back in December, and this is where my concern comes in. I think it happens in town, when things are new, but I would say I wanted to know how somebody could become a committee member, what were the dates for applying. I reached out to several people. My husband, who's a former selectman, Brian Valcourt, reached out as well. We couldn't find any information. We couldn't get any returned phone calls. Dina is here with me, and my concern as a resident is having someone that is expert in the field. As you're all over here talking about, who does this and who does that, I can tell you she probably had 80% of those answers like that, right? So reinventing the wheel, right? We don't want to reinvent the wheel. I think time is of the essence. Also, she reached out to several people and couldn't get an answer on applying to become a committee member, and I think she'd be a great addition, and I'm here to speak on her expertise. I can speak to her expertise in what she does, but I also want to speak as a resident. And also, I'd like to know, the question would be, are all the committee seats filled according to this, I guess I don't know what it is, proposal or state mandate or what it is for, I know that you're supposed to have a parent with a student that's currently in the school. No? So,
No,
maybe
no.
you could tell.
There is a charter. And
Okay,
in the charter, it's identified the specific seats on the committee. That was decided with the select board. So it was presented to the select board, and the select board made some changes in the configuration. So, one of, the only seat that is not filled right now is someone with lived experience, someone who's in recovery.
Yeah.
And that's the only position. We have a clinician, Dr. Dorsky, you have a member of the Board of Health, a member of the Select Board, you have 2 citizens, 2 residents or community members, which is Pam and which is Val. Then we had to have a representative from the police department and a representative from the fire department and a representative from the school committee.
Okay.
So those positions have been filled. There may be a point where someone on the committee no longer wants to sit on the committee, then we would have to find someone to take that seat. But there are 9 seats, and the only seat that is available is someone with lived experience.
With lived experience, okay.
Somebody who's in recovery.
Right. So, and where do you advertise this so that the community out there might know when you are looking for board members, or where did you advertise this?
Well, we didn't really advertise it. It was asking people. We had a meeting with the select board. We talked about the seats we needed, the people that we needed on the committee. Val happened to be at a meeting. She let me know she wanted to be on the committee. I reached out to Pam because I worked on last summer. We did a presentation at the middle high school on the impact of opioid addiction on individuals, families, and communities, and Pam was one of the speakers, and I was one of the speakers. I'm a clinical nurse specialist in mental health, so as far as, clinician and experience, I certainly have a lot of experience as well. I think that
I'm not doubting anyone's
Yeah, no.
experience, by the way. I'm just saying you have someone sitting here, and I'm sure just like this gentleman said before, we have a brain trust here in Westport. Why wouldn't we have reached out to the community to say, who knows who's lurking out there in Westport who has extreme experience and she's able to answer probably 80% of the questions you had, seeking about who does this and how many patients do
It
they have
sounds
for
like you're
that.
advocating for her right now.
Well, I am, because as a taxpayer, and this is a great opportunity, I would like to see people that are, just like this gentleman said, we're not reinventing the wheel. You can just turn to someone and say, what is that? Where did we get that? Where's that data? That data should, I mean, we don't even know, we don't even have the data that you said the state, or do we? It sounded like maybe we didn't. The data that the state made, the dollar amount, the 35,000 that they said they'd grant us, do we even know where that data is, where it came from? Because it sounded like we didn't know. Do we know?
I think collectively the town knows, but that members of this committee aren't intimately familiar with. I mean, again, this is our second meeting.
Right, I know, that's
So-
what
so-
I said,
so-
I get
you know,
that, I
you know,
get
part
that.
of it is, we're still trying to figure out what we need to do and know in order to do our job well.
Right,
And we're also, this committee was created because I think we had received the money and the town had done nothing of a structured way to deal with it. And I think the Board of Health sort of raised the issue about having a process with that. It came up, usually when we have committees that have vacancies from the select board, we put it in our meeting postings, so it's part of the agenda for each meeting that's published, whether it's, and we do list what are our vacancies for the committees. It's on our website, the town website. But is it outreach recruitment? No. It's a town bulletin board, let people know who you're looking for and the kind of volunteers you need. And there wasn't, and nor is there for many boards, to be honest with you, a concerted effort to recruit volunteers. There's an assumption that people that want to volunteer know where to look. That may be faulty. And that the select board has been, at least in recent years, because I say back when I was on before, there wasn't as much attention in trying to recruit committee members. And we tried to do it ourselves once a year to try to find out who we wanted to appoint. And if people asked us if they wanted to be in a committee, you know, we put their name in the consideration. But now there's a more systemic way, at least since I got back on the board, of the board sort of seeking out and advertising vacancies on the committees.
I guess my question would be, there's sort of two processes, right? Like, what are the options or not around joining the board at this point? But the other one is, how can we get your input? What's interesting to you? What should we know? How can we work together?
So she came because I've worked closely with her in the past, but my son and daughter are at the high school level. My house is kind of the house where all the kids go that get kicked out because they've done drugs and their parents can't deal with it. Parents don't have education here. I'm a substance abuse counselor. I work at Stepping Stone. I'm also 2 classes away from my master's, and then I'm going for my PsyD. I'm very highly interested in addiction.
Could you say your name for the
Yes,
committee's
sorry, Dina
benefit?
Desmaris. Sorry.
DSMARIS.
Desmarais, and first name Deena.
I did have a conversation with you.
We did. So what ended up happening is I spoke to Chris, and Chris is like, there's one more open spot, and then I guess he didn't get to you soon enough, so then there was some kind of spot or something. But I think a parent needs to be involved on a committee like this, because I see it firsthand. The things that are going on at that high
Have a
school.
parent.
Oh, I know, but I'm talking about 13 and 14-year-olds right now. It's really dangerous. There is multiple people selling vapes currently at the high school level. I had them tested, and they're not just vapes, they're not just marijuana, there's chemicals in there. Vape alarms aren't gonna help. The counselors, you can talk to them till they're red in the face. If they're gonna do it, they're gonna do it. There's counselors at the high school, which they do great with, but I think the input on the committee as a parent, as a child attending now, would benefit. Just because I know what's going on and what's being said to, I mean, my 14-year-old will come home and tell me and he's not innocent, by no means. There's a lot of bullying going on. Can you hold this for me? You know, and then that person gets searched. So there's just a lot of inside stuff going on that the principals know about. I've spoke to them. I'm very upfront. I didn't find out about this settlement committee until I went into the principal to speak to them about Paula Young, who is an individual who lost her son also to fentanyl, I think, maybe 2 years ago. And she has a great panel that can come in. The DA comes in. They talk about press pills, because that's another thing. Athletes are taking a leave. It's not a leave. It's press pills with fentanyl, and they're overdosing. So that's huge for me. I mean, my son's an athlete. All his friends are athletes, but I'm seeing all his friends changing from taking all of these, you know, illegal drugs. And the parents are just like, oh, well, we'll just send him to therapy and he'll be done. But it's not enough. The parents need the education. So I just think as a parent, it would be important to have somebody like that as an input, just because I have a 14-year-old, 16-year-old, a 23-year-old, and a 25-year-old. So I've kind of been through this.
You have somebody that old?
Yeah, she's married too. But I've been through her being in the Westport schools, and now she's 25. I was not afraid as I am now.
Okay.
I mean, it's.
Well, what I like to suggest is that one of the things that we wanted to do, and we talked about doing was with Laura Charette, was doing something at the high middle school involving parents and even meeting with the Parents and Teachers Association and getting feedback like that, but doing a focus group in the school. Would you be willing to help with that?
Yeah.
Okay, great.
Sure.
So as we're in the planning stages and what we're going to be doing for focus groups, at the end, you can give me your number again.
Okay.
And we can work on something for the school and talk to Ms. Charette about that.
And Laura Charette also has the proposal that I met with the superintendent and her back in December about the panel coming in.
Okay.
It's Paula Young. She does a great presentation, and that's how I actually kind of found out about everything. So,
Is that something you're advocating for the schools to do
yes.
this year? And is that a funding issue?
It's really not a funding issue. She just said she had to bring it to the board in order to get it approved.
There's the chair right there.
Hi. So, I mean, but I sat down at the chair and I watched the whole symposium. It was like 8 hours, obviously. We wouldn't do that at the school. But I really do think it needs to be a during the day thing for students and then also at night for the parents. I mean, I was talking to her about the things that I'm dealing with, and she has older kids, but it's just so much different.
Right. And separate from this committee, I would be very happy to work with you on any, because I do Mental Health Awareness Month in May, and I always try to run one program in the school.
Yeah.
So maybe you and I can come up with a plan to address this issue and
That would be great.
work on a presentation together. I appreciate you speaking up.
That'd be great.
And so, you know, we're a committee, but we're open to hearing from people about what they need and what they think would be most helpful. That's part of our purpose. So I'm so glad that you came today and spoke with us about your concerns.
And we
you.
still looking for somebody, if you know or could help us secure somebody with lived experience. that
That's
would be-
from Westport.
From Westport.
That's in recovery.
Yeah.
Yeah, I have a few in Westport, but they're not willing to.
Yeah,
I mean, that's usually the problem.
And that was one of the things I mean, we've been checking with lots of different people to see if they can help. And one of them was with the detective who does follow-up visits to see if there's anyone. And she did have someone in mind, but she said she's not sure she would be willing to do it. But I said, they have to know that there is this formal process that we're in where you're very public
Correct.
Because of open meeting laws. So, but that doesn't mean that people who are lived experience, if we have focus groups, can't come and share what struggles they're having, what they need help with, and then we can look at that in terms of a programming.
I would also just, oh, sorry, you.
Can I ask a question? Are you currently a counselor,
Yes, as stepping stone.
and you're working toward your master's degree?
Yes,
And how soon will you have your master's degree?
March.
So in March, you'll actually be a clinician, won't you?
Yes.
So then you could replace me on the committee. No, I mean,
He's serious.
well, I mean, I'm just saying that since you actually you're doing it, I'm not a counselor. And
But you work with patients who
I
have,
don't, I'm not actively working with patients.
but you have experience
I
working
have
with
lots of
patients.
experience working with people with substance abuse, but I'm just saying that I just want to clarify that you will actually be a practitioner. You'll have a license.
Correct.
You'll be a licensed practitioner in March.
Yes.
Is that correct?
Correct.
Okay, just for my.
Duly noted, right? I mean, I guess that's
What are
what,
you trying to get out
I'm
of being
not-
on the committee?
I'm not trying to get off the committee, I'm just trying to.
no, I think it's a fair,
A role for you.
right, I had the same thought, like, what can we do? If you have this passion and this knowledge, it's a loss for us not to
Exactly.
take advantage of it. So what are the ways that we can do that? And so I think, I would encourage you to keep coming to these meetings and participate actively, and we can continue this conversation.
Sounds good. Thank you.
Thank you.
All right, were there any other topics that we didn't anticipate that we need to address? Okay, so that I move, or I ask for a motion.
Entertain a motion to adjourn. So moved.
Thank you.
Third.
Okay. All in favor?
Aye.
Aye. Okay,